My name is Caroline Schnickers. I'm the co-chair of the Special Interest Group for the Disorder of Consciousness of the IBIA. And today I know that you are here for a very exciting webinar on a new booklet that the ACRM has created. And I just wanted to give you just information that will be helpful for the future if you decide to go further with us in the IBIA. If you're interested, we have several conferences that are coming up. There is the ABI 2024 that is in March of this year. It will be in Las Vegas, so definitely a lot of fun if you want to join us. It will be from the 27th till the 30th. We have a few sessions, actually, a few good content on DOC and disorder of consciousness if you're interested in. And so please join us. You will find the site for the ABI on the IBIA website. It will lead you over there. And I'm sure if you type on Google ABI 2024 Las Vegas, you will find it right away. So don't forget to join us in March. Yeah, that's just a few words I wanted to give you before starting this webinar. So first, I wanted to thank you both, Brooke and Amy, for accepting presenting. This is a very important content, and I'm very privileged to introduce you today. So the title of your presentation is Knowledge Translation in Action, a comprehensive web-based resources for family caregiver of person with disorder of consciousness. I think that now it is online, so maybe not the entire content, but I know you're working on it. I know you have been working hard for doing this document that will be helpful, I'm sure, for family. And just a few words of introduction. So Dr. Amy ShapiroRosenbaum has a background in clinical psychology, school psychology, and clinical neuropsychology, and over 20 years of clinical and research brain injury experience. Currently, she is the director of the TBI rehabilitation program at Park Terrace Care Center. She also served as a TBI model system investigator and adjunct faculty for the Econ School of Medicine at Mount Sinai. Then Brooke Murtaugh, Dr. Brooke Murtaugh, received her Bachelor in Science in health science, actually, from Wayne State College, and then clinical doctorate in occupational therapy from Creighton University in 2004, and began working as an occupational therapist at Madonna Rehabilitation Hospital. Thank you both for being here. We're really looking forward to hear you. So without waiting a minute more, please proceed. Thank you very much.
Hi, everyone. Thank you guys so much for joining us today. Brooke, you could advance. The first couple of slides are going to be a little bit awkward as we had a little technical difficulties with our slides. The goal of this webinar is to, as Carolyn said, let you know about a new consumer-based product that we have developed for consumers, in particular for family caregivers of persons with disorders of consciousness. Next. Before we go on, we just want to take a second to give a shout out to Susan Johnson, our fearless leader. She was our previous chair who recently retired, whose tireless work is largely responsible for making this happen. And this is our committee. We are a subcommittee of the ACRM Brain Injury Special Interest Group on Disorders of Consciousness. And so just to give a little foundation for why we wanted to create this product, we thought we'd start by sharing a couple of families' experiences. Hopefully you'll be able to hear these videos.
Not her, no.
That's not the first one.
It was the intern, I think. She told me that he would never be able to breathe on his own again, that he would always need a respirator, and the respirator doctor says she had no right saying that. I don't think that. You know, like there was miscommunications and stuff, and then, you know, and then before he left there, by the time he came here, he had the trachea tube, but he wasn't on a respirator.
So that slide just essentially shows the inaccuracies and inconsistencies in the information that families
The
receive.
education we got
next
was
one.
great from the physicians. They were wonderful, they were available, they were there, and they talked to us every day and give us a full we had a full understanding of how her day was, how it was going to be. The majority of the nurses knew, but we did have to call them on the fact that some of the nurses did not know her plan of care for the day. And that was extremely important for us when we were trying to make sure, is she healing? Physical therapist did do what was called a coma test. And she told us we had to leave the room, and then she told us that she was a 2. And she gave us a piece of paper on that. And I don't think Bill and I really wanted to know, honestly. I just put that aside. I said, I'm trusting in God that she is going to move up to the next level at some point. And things like that scared me a little bit.
Okay, I'll just swap screens with you now. So that one, interestingly, also depicts that not all information is created equal. And in fact, more information is not necessarily better. They seem to be very appreciative and wanting of the practical guidance with respect to what the everyday daily care involved for their daughter, but honestly wanted nothing to do with the more sensitive types of information like her actual diagnosis or what her prognosis or CRS level functioning was at that time. So that sort of just lays the groundwork for why we, what we assumed is patient experience, and that was sort of the impetus for taking a little bit of a deeper dive. So the first step in any knowledge translation project would be to take a look at the evidence. And so we'll just give a very high level overview of what we found there. So first, just taking a look at what we know about caregivers' educational needs and what their experience is after their loved one has a disorder of consciousness. This scoping review, you might notice, is from 2022. This project that we've been working on dates back before the publication of this review. We've been working on this since 2017, but all of the articles that we had extracted data from originally for our purposes were included in this scoping review, which just represented a larger sample that only reinforced and expanded those earlier findings. So what is important to take away from here? Well, number one, not surprisingly, caregivers experience a high level of physical and mental health burden, as well as a high level of social environmental burden. But a couple of really important things to point out here is, at least in the 5 to 6, 8 articles that were published up until 2016, they were all done on one large cohort of patients throughout Europe. And these were institutionalized patients. These were not patients who were being cared for in the home by their loved one. So, so that's important because hours of daily care was actually significant. Obviously, on the slide, we included the range, which is pretty much 0 to the max. But on the whole, the important thing to notice here is that as a group, they reported a significant number of hours providing daily care, even though their loved one was in a nursing home. So much so that over 65% had to quit their jobs, either temporarily or permanently, because of the amount of hours that were necessary to provide. And number of hours providing daily care directly impacts on perceived burden. That perceived burden actually plays a really big role. In fact, caregiver perceptions in general plays a big role. As you see, perceived social support actually impacts depression more so than actual social support or financial pressures and other things like that. But importantly to this project is the level of perceived burden impacts or mediates those negative mental health and physical health outcomes. And even more importantly, impacts express needs for information and support. So that families who had higher levels of perceived burden express the greatest needs for information and support from their care providers. So now we take a look at sort of the guidance on what that might look like. And in subsequent years, as we were starting to work on this, 2 important publications came out in America. The first was the DOC practice guidelines paper, which didn't really specify too much about caregiver needs, but does include specific guidelines with respect to prognostic counseling. And the key message or take-home message from those recommendations is the importance of providing accurate information that's high quality, that's consistent to family regarding expected outcomes. And then in 2020, the minimal competency recommendations document was published. This one was more directed towards programs that provide rehabilitation to persons with DOC, and so was actually a bit more directive with respect to what should be in place for any programs that serve this population. And so they had 2 dedicated recommendations to cover this topic. And just to highlight, they provided specific direction, for lack of a better word, on what that should look like. It should be individualized. It should cover these specific topics as laid out here. And beyond information, it should also allow for access to resources for both emotional as well as financial and legal issues. Oh, why can't it? Then taking a look at, so that sort of framed for us the idea of, okay, we've got a list of general topics of what we would need to do, but how would we structure that and what would that look like? So we then turned to the research to see if there were any existing frameworks for providing family education or educational curriculums that we could sort of use as a jumping off point for thinking about structure and vehicle through which to provide this information. And there at the time was nothing specific to disorders of consciousness, but the closest we could find related to a model for caregivers of stroke. And although not a direct correlation, because they're obviously the levels of care are different and more direct after stroke, but some of the key messages that we heard from there were very similar to what we heard in our focus groups, which was also part of what we did. So you got a sneak peek of those focus groups, but those were actually done as this part of the process where in addition to trying to look at frameworks, we met with the families and just tried to get a sense of what their current experience was, what types of information they wanted to receive, what they did not want to receive, how they like to receive information. Just to, again, to try to start to frame that thinking of what the actual end product would look like. And the key message from that collective research is that timing really is everything. Their needs change over time. Early on, there might not be, as you saw the first couple express, too much interest in really listening or hearing about the big picture, which is personally fine by those of us who understand that people really shouldn't be given blanket negative prognosis anyway, so early post injury. But there's also going to be individual variability in that. Some families may want to hear things right out of the gate, whereas others might not. So that sort of begins to shift the thinking to needing to create something that's going to be adaptable because every individual is different. Also understanding that these collective needs that have been identified as important need to be further subcategorized into things that would be considered practical guidance versus those that might be sensitive information, because the sensitive stuff might be better directed by a care provider who's guiding the caregiver through that process. And so this model just sort of brings that whole piece together. So if you think of practical information, things about daily care, as well as just actual tests and medications, things like that, whereas the sensitive topics are things regarding long-term care issues, diagnosis, prognosis, as well as decisions relating to withdrawal of care and things like that. So even though not only do individual caregivers vary amongst themselves, but even within themselves, their needs will change over time. Their readiness to receive information will change over time. And so we have to kind of have a model that allows us to keep the finger on the pulse and not view education as a one-shot deal. It's something that should be an ongoing process as they move through the continuum and through their own emotional process. So the end of that led to the conclusion that what we really needed was to create some sort of comprehensive educational online resource that could be widely accessible and customized in a way that makes information more easily to digest, snackable bites, if you will, using the same sort of analogy that depending on the amount of information a given family or person can handle at any time, they can choose however little or however much information, and they could be self-directed and empowered through that process. So that moves us into the design. So at that point now, remember, we knew we had topics and we had the evidence to support it, but we didn't have actual materials yet. So the next step was to actually begin to generate those materials, or do an environmental scan more accurately to obtain those materials. And so that was where we reached out to national and international known disorder of consciousness programs. We also subdivided groups who did environmental scans of online resources, with the ultimate goal of that phase being directed by search terms and things like that, to cover all possible resources from YouTube and other videos to websites, as well as homegrown materials that were coming out of programs. And although we still haven't really gotten far with the last goal, one of the original goals was also to identify gaps, because one of our original thoughts was, do we disseminate information that's currently available, or do we create new products for those things that are not yet available? So that's one of the longer term goals at this point. So this is just an overview of that data gathering process. The surveys were sent to over 1,100 national and international CARF accredited brain injury programs, as well as to all of the current and past TBI model systems programs, also all of the facilities where the work group members belong to. So in total, we ended up with 37 programs that responded. Of those 37, 23 had information specific to disorders of consciousness, and 15 were willing to share their information for the project. This is the listing of facilities that did share. Although in the end stage now, due to some changes in policies at a couple of these places, a couple of them have pulled their materials out. And so we're currently trying to replace some of those. So the next step was then to vet those materials, and that was really an internal process, relatively informal, but we were trying to gauge, making sure based on what our internal expert reviewers knew, is the information accurate? Is it easy to understand? Is it coming from a reliable source? And in many cases, we had a lot of different resources for the same topic area. And in that case, we tried to narrow it down to the ones that sort of represented the most comprehensive and consumer-friendly product. And then we went through another round of, I guess, focus groups. I'm just sorry, my arrows here. Focus group work based on a temporary structure that we came up with. So we now developed all those, or organized all those materials, and based on what we had learned from the Timing It Right, figured dividing it, categorizing it into 4 tentative groups of information about the body, information about the mind, taking care of self, and resources was a tentative structure that allowed families, based on whatever their questions were at any given time, to either jump into the mind questions or to avoid them if they didn't really want to know about recovery and that type of stuff. And so at that point, Shepherd Hospital had been willing to create a pilot website for us within their existing website. And so we met with professionals and families, again, had them dry run their website. At that point, we weren't really having them vet the actual material so much as the structure, the layout, the usability of it, whether they felt that it would be something that they would be able to easily navigate on their own. And if there were, just looking at the general topics we had included, if they had any feedback or additions that they thought that we should be including. And so the outcome of that was we ended up collapsing body and mind, since there was a lot of overlap between those two categories. And so we ended up with these three broad categories of body, mind, self, and resources. And these are the general questions that we're going to go into or topic areas that we're going to go into the ultimate website. And so now we needed to actually create the website. And so to make a very long story short, that was actually one of the biggest barriers, was finding a partner, was, that could create something like this. And that would be in a way that would right off the bat be something that families could access. So as luck would have it, we ended up connecting with Brainline, who is a very well-known and reputable educational provider on topics relating to brain injury. They are come up high on a list if you type up brain injury education. And so that was even better than we thought. We were originally trying to create something ourselves or maybe house it within ACRM, but this is already a known entity to consumers. They already work with the Wounded Warrior Project, and most of their existing content at the moment is focused more towards mild TBI and post-traumatic stress disorder. So they were actually really excited to be able to expand their educational offerings to the more severe population. And again, for us, it was obviously a win because they were already a known entity who already had a lot of this content on their website. So it was a nice logical extension. And so again, that sort of brings us to where I'm going to start to shift over to Brooke, where we kind of left off. Was now we had this whole bunch of collated products or links, PDFs. But if we wanted to create an actual website, we were going to actually need to write the website. And so that became a whole other phase of the project. Just before I pass it over, what we ended up handing over to Brainline at the time, and it has obviously shifted a little bit since there, but the topics are still the same, was thinking about the topics in what we called hubs. These are the general areas, but what we now needed to do was going to be create the content that sort of was the lead-in to the links that were going to be on there. And I'll pass it over to Brooke, who will be able to tell you a little bit more about, I'm just going to stop sharing so she could share about that process of vetting materials and writing materials, and then we'll give you a peek of the website.
There, let me unmute myself. Okay. So thank you, Amy, for an overview of the genesis of the project. And so yes, how do we write material that's going to go on a consumer website? So thinking health literacy, families, to make a very complex topic, even for us as clinicians, with high-level nomenclature and terms and understanding what's happening with severe brain injury that results in disorders of consciousness. How do we bring that down to a level to families with varying levels of health literacy so that it's understandable and digestible? We don't want to put something out there for families that is too high level where they're like, I don't understand this and there's no utility to this product. So we used the TBI model systems in the US. They have a website for consumers on various topics on brain injury. So they have a guide that helps clinicians who are developing those fact sheets put terminology into understandable terms for non-healthcare professionals and families. And so that's what we turned to be able to guide us on how do we write about this complex topic, even little snippets to lead into the different website links that we were including into the website. So first we looked at, okay, purpose. So what is the purpose of what we're writing? What is the purpose of the introductory? Is the section focused? So really taking each snippet of each section body, mind, taking care of self and resources, and making sure that the introduction and the first thing that the consumers are going to read is very explicit and understandable and focused in what are they going to be going into if they choose to go into that website link. And then content, determine the content of what are we going to include in that. Is it actionable? What is the emotional impact? Does it pull and create interest to that consumer and family of like, oh yeah, that's hitting a nerve. I want to know more about that because I'm experiencing that right now. And so is it encouraging for the family to take that initiative to go in and dive more into that information because it is applicable to them and their current situation. Plain language. This was probably one of the most challenging parts is we write how we write as professionals and clinicians. And, you know, Amy's published multiple pieces of peer-reviewed literature, as well as many others in our committee. And so how do we then take how we write and how we think about disorders of consciousness and bring it into plain language? And so that took us quite a while because taking that medical terminology and using the different tools of like being able to cut and paste a sentence or a paragraph into, you know, what grade level is it? Because Amy, remind me, we wanted it at like an 8th grade reading level or below. You're muted. I'm trying to remember.
Somewhere between
so
6th and 8th grade is really the ideal.
So again, think about this material and trying to take it down to a 6th or 8th grade reading level. And so being able to switch out our words and make it more simplistic, having a second person narrative and making those sentences and the points we're trying to make very short and simple. I guess I could have read my last bullet point and that would have told me the reading level. How to organize. So do we have it clearly organized? You know, we write, we're making it simple language, trying to get, you know, to that lowest possible reading level because we know we could have people, you know, accessing this product who do have a high level of education and maybe some medical background or knowledge, and then some who have very little education and very low health literacy. And so making sure that we're organizing the topics so that it's very clear what the purpose is and identifying the takeaway point. So it's just right there for the consumer and kind of hits them in the face so that, you know, they're not searching of like, this isn't really answering my question or this isn't what we want to know. And so below is just a snapshot of the written packet that we then turned over to Brainline to take that into a website format of, so this is an example, how do I manage a ventilator or tracheostomy if I take my loved one home? And so then the little snippet that we were responsible for writing, and then the link that is most applicable and has the most utility to that question is right below it. Here's another example. So kind of what this would be the first page, and we're going to show you the website here as we finish and how to navigate it. But what are disorders of consciousness? So being able to have that right up front if they click the body mind treatment hub. And then being able to quickly describe what the link is going to include so that they know, hey, that is of interest to me. I want to go more into that link. And so that's just an example, again, of what we wrote that we gave to Brainline that they then took and transcribed it into a website format. The model systems, the TBI model systems guide on writing fact sheets also really encourage the use of visuals. You know, we're all different learners, maybe reading, you know, and just taking it in by reading. And there really isn't an auditory learning component because it's a website. We do have a few YouTube videos that have audio, but, you know, having that additional visual. So this is an example of a picture and diagram that we included, you know, wheelchair positioning and what to think about, as well as different parts of the brain and understanding what parts of the brain control different functions of the body so that we have the ability to cater to different learning styles for the consumer. So once we had all of that together in a document, before we sent it to Brainline, we had another layer of vetting the content of how it's organized, how it's written, are the websites and links and the content that we're including have utility, are they accurate? So we again pulled in not only our families with lived experience, but also other DOC experts from multiple disciplines to take a look at it. So that again, from an accuracy perspective, is this the most evidence-based, accurate information, but yet is it written in a way that is understandable for consumers? And so we sent those out. We sent out content, families and professionals, because this ended up being a very large document. So we didn't want to have families and professionals take time out of their busy schedules to go through the whole entire document. So we would give them different pieces of it to evaluate and then give us feedback on. So we had 15 families and 16 professionals, and this is some of the feedback that they gave us of emphasizing within our wording and the information that we're trying to project that each person is different, and that this is more, I don't know if general information is the right way, but know that there is going to be some variability of the information we're giving depending on the patient. Including statements that you don't have to manage this all on your own. It's just not all on you as that family member caregiver, that you need to develop that team of support and guiding caregivers and focusing on what's within their control. And we did get some feedback that some families didn't like the word recovery, because we use that a lot in the document. And so quantifying how we are using the term recovery and having a disclaimer of this is how we're using it within the document to talk about disorders of consciousness. However, we do acknowledge that not everyone will recover A, consciousness, or B, a full level of functional recovery. And then some of the feedback we received from our disorders of consciousness professionals was the medical content, making sure that we were clear on the medications, having more clarity around the information related to do not resuscitate and withdrawal of life-sustaining treatment information, and also improving the clarity and expanding the different physician subspecialties that could be involved with your loved one's care. They had some comments on the resources already. We were alerted to, hey, some of the stuff that you have included isn't working, or those links are no longer viable. And so developing a process like, how are we going to make this sustainable so that we make sure it's a continually growing and working and functional website as well, knowing that some of those links sometimes become invalid or they pull information. So that's a process we're still working on, is the sustainability piece. And then wording, again, adding disclaimers about certain things, making sure we're consistent in our language usage, and still trying to simplify our wording to make it understandable. So then going back to our cycle, so we've done the evidence review, we've organized it, we've identified the website, and now here we are in these current steps of dissemination and implementation. So promoting access and use, which is why we're talking to you today. Because now that it's very, very close to be ready to go and ready for consumers to access, the only way consumers are going to access it is if us as their caregivers and clinicians and their professionals are making them aware that this product exists. So we want to kind of provide you a snapshot of what this all looks like now in a website format, so that you know how to navigate and where the information is located, because the overall goal of this isn't necessarily to just, hey, family, here's this brainline.org DOC Hub link, go for it. Still ideally, it's going to be best processed in being able to have the time to sit down with your families who are experiencing a loved one with DOC and help them start out in the navigation of this. And, hey, here's the information. If you're looking for this, if you have this question, Maybe again, you're not ready for the information on legal and different resources and guardianship. That's, you know, a little high level or looking more long term because we're sitting here on day 7 in the ICU. But maybe your team is using the term disorders of consciousness and you want to know, what does that mean? So we want to open this up and show you where it's at right now. And is it sharing? Or do I need to reshare my screen?
You might need to reshare to pick your
Pick up.
browser window.
Oh, wait a minute. There we go.
I just want to reinforce too, since we're taking a quick pause on that, it's really the minimal competency recommendations that we're recommending following here, which is that the care, obviously, there are going to be circumstances where people are living in remote environments and they don't have access to any service delivery system that really understands DOC. And that was one of the first reasons that we thought this was important. But ideally, even in programs that do know what they're doing, it's about the program having a process in place to first identify and gauge where the family's at, what their educational needs are, and them to be still directing the family through the process.
So when you go to that link, here's the landing page for the Disorders of Consciousness Hub. So it has a little bit of an introduction, and then you can click on these different colored tabs or hubs to get to the information. So then again, as Amy was saying, in little snackable, digestible bites, you know, maybe a family only wants to know because they're in the ICU, they're in that very acute phase of injury. What are disorders of consciousness? And so you can go in there, and it has the outline of what's all included. But then, so this one, facts about vegetative and minimally conscious states. So this is from the TBI Model Systems Knowledge Translation Center, so they can click on that, and it'll take them right to the fact sheet.
So it's almost like it's serving like a centralized hub. We're not housing any of these material. I mean, there's some things that are going to be PDFs, but for the most part, these are also just funneling traffic to the source.
Yes. So it really is a one-stop shop. That was one of our overarching ideals in developing this project and starting in on this multi-year endeavor, is can we create an easily accessible one-stop shop where they have one place where they can go and get a very comprehensive experience of different aspects of disorders of consciousness education. Let's pick another one. Like, how do I interact with my loved one when they are in DOC? And so this is one from Tier Memorial Hermann that they gave us permission to use. And it's one of their PDFs that they developed. But why create the wheel when they're willing to share it with us? And it's great information. And so just funneling people to resources that are already out there. But again, what if you're not a tier, or you didn't get access? You know, you weren't approved in the US by your insurance to go to a specialized post-acute care. You're not going to get this information. Let's see, how do I get out of this one? Where's my back button? So then if I go back to the landing page, let's look at additional resources. Again, just to give you a flavor of what is included. Actually, that one I don't think is completely done. Taking care of myself. So this is more focused towards the actual caregiver of how do you take care of yourself as a caregiver, because you have to be healthy in order to provide effective care for your loved one. And so we talk about caregiver fatigue and burnout, and that section links caregivers to specific information about caregiver burnout. You know, Brainline itself, we're linking back to information they already have about compassion fatigue. You know, how can I take care of myself? Family Caregiver Alliance in the US. You know, what are some of the self-care activities? that you can do to kind of give yourself that respite and break. So that just gives you an idea of what this website's going to look like. We actually have some additions that are in the works where Amy and I have gone through this with the Brainline website developers and like, hey, this section that was in our core document isn't in here. So they're in the process of, adding that information, but we like the organization. We think it's easy to navigate, but we're also open to feedback. I know I presented this topic at World Congress in Dublin almost a year ago, and our international colleagues were like, hey, this is really great, but maybe this isn't applicable in Europe or Asia. And is there an opportunity to add more internationally focused content? Because right now we pretty much have US resources, and our additional resources talking about guardianship and applying for Social Security, disability, that's all very US healthcare system focused. So that is definitely a growth opportunity for us. Let me stop.
Brooke, I just wanted to hold on, sorry, just before you stop sharing, go back. I just want to show them where ultimately how it will be able to get navigated to, in case that's a question. So right now, like if you were to plug in the link that's on the slide that Brooke will show you when she pulls back up, you'll come to this page, but it's sort of hidden within the Brainline website at the moment because it has not been officially launched. So if you scroll up to the top where the tabs are, this is part of what we were trying to figure out last time, but it will likely either be its own additional tab here or will be under this caregiver tab. And under caregivers, it would then have, the DOC hub. And so you'll be able to link directly to it. So I just wanted to clarify that. It's not like this is, if you go to Brainline, you might not find it right now, but you'd need to plug in that exact link, which we can copy and put into the chat.
Yeah, so we're at this step for access and dissemination as we continue to finalize the website, but the biggest facilitator for that is getting the information out so that you at the bedside and interacting with families who are experiencing DOC know that this is a resource. So questions, comments, feedback.
I have a few questions actually from attendees. Thank you so much for that presentation. It was very important. It's a very important topic, and I think that the problem that we have right now is really to interact with family. As you say, it's very hard to adapt the language, and sometimes we talk and they understand half that we say because they are not from the field, and so it's just very hard to have that kind of adaptation. And so having a website where they can read about it in their own on their own level, at their own level, that's really very helpful. There were a few questions about translation, and I think you tackle it a little bit, Brooke, indeed, but also about how easy that is to find the information you need in a specific setting. So when you are in acute care setting, of course, you will need different information than when you are in a SNF or long-term care facility. And so on the website, is it easy to actually find the information you will need according to the setting you are, or your loved one rather is in, or how do you navigate?
So I think that that was one of the first things that we were trying to figure out. And when we were using the timing it right model, which was the Cameron article, they did it by level of care for stroke caregivers. So it was very much like, what information do they need during event diagnosis versus in acute care hospitalization. But what we know about DOC care pathways is that there's no one uniform care pathway, nor time post-injury during which caregivers are collectively tend to be in the same environment. Some people go directly to long-term care, whereas others manage to make it into an acute program. So we tried to create a structure that was not level of care specific, but rather information specific. So people are not, our presumption and the feedback we got from families are that people are not going to be on there looking at what do I need to know in acute care. People in acute care are going to have select topics that are relevant to them. And so they're more likely to search the topic that they're looking for. And those topics are taken into consideration to cover the entire continuum of care, from what you'd need to know in the acute care level to what you might need to know after you're home and you've been home for years, and the focus shifts to be more about quality of life for the caregiver and striking that balance over time.
And we do have a section under that first brown tab of what is disorders of consciousness that is a heading of something to the fact of what do I do when they say my loved one's ready to discharge? And within that, we have the different levels of care and explanation and what to expect at those different levels of care. Because yeah, there isn't a systematic or standard, especially in the US, pathway for DOC patients. You know, Amy's right. They could go straight from ICU to long-term care, ICU to a skilled level of care, or ICU to home, you know, and not have that ideal ICU, a specialized post-acute inpatient rehab setting, and then down the line.
Yeah.
So that's how.
It's just I like the fact that it's actually, you know, independent from timeline, and just indeed families search for topics, and then, you know, they just need to find more specific information. It's just there. Again, thank you, Brooke, for highlighting the international dimension. I think that there is a lot of interest in maybe translating, you know, in other language. But also maybe adapting some content to a more international crowd. Of course, you know, I have been highlighting that with discussing about this with Brooke, and she knows because she's a part of the family task force of the IBIA DOCSIG. And we would love to, you know, work with you guys when you feel ready to adapt some of the content and find a methodology to actually make sure that this content might be adapted to, you know, Italy or Germany, and make sure that I say that because I had some comment from German colleagues who were interested in actually maybe translating and adapting some of the content. So but that would be great to collaborate on that. I would just finish with asking you, you know, regarding the challenges of dissemination, because it's a very important product. So do you have any plan on, for example, you know, just creating some video that will be on TikTok or YouTube or Facebook, that could actually reach, you know, a large crowd, and also raise some awareness, to tell you the truth. I mean, it doesn't have to be patient with disorder of consciousness of family, really, per se. It might just be touching some other crowds that are interested in that topic. So how are you planning to do for that?
So I'm sure Brooke has things to say on this also, but I think that first of all, there's a few elements to what you said. Number one, just sort of on the heels of the level of care question, it is more adaptable universally if we're not sticking to levels of care, because those are different in different regions of the country or in different countries, of course. We're particularly grateful for the invitation to present at IBIA, because that does help get the word out. Brooke and I are both also very involved in the Curing Coma campaign, which is an international audience, and we've been in discussions with them on just trying to figure out ways to collaborate. But this is, you know, this is the current focus, is sort of exactly these questions that you're asking. And I think that there is some we are still in the process of fundraising to support. We have enough money at the moment for Brainline to create the website, but the second $25,000, which we're currently in need of, is would be dedicated to these things. Search optimization to make sure if you look up coma or certain keywords that the website pops up first. Maximizing social media venues, Facebook, YouTube. That we have a partnership with JoJo's Cause, which is one of our main funders. We just already recorded videos. They're going to put them out in different there's going to be 3 different videos, one full-length video, one with the interview of the owner of the organization, one with me talking about the project, and those going to go on YouTube, on Facebook, on Instagram. But we need some experts, not just DOC experts, and international input, of course, because there might be materials that you guys have across countries that we don't, even though we did survey international facilities, still now we have better access through these more recent connections. But really having like a knowledge translation and dissemination type of expert to help come up with what a dissemination plan. And that's sort of, we're doing it in piecemeal now by trying to get the word out through these presentations, but creating something more cohesive would certainly be an important next step.
Yeah, because like
it's absolutely crucial.
Month, myself and 2 other of our committee members are presenting to the American Academic Physiatry Conference in Orlando. And then this very similar presentation will be at ABI 2024 in Vegas, will be a session. So yeah, definitely very piecemeal, but that is the definite next step when it's ready to go. I have a couple of questions quick before we run out of time. Would this be more useful for families of someone in initial stages, post-diagnosis, or even for families?
Actually covered.
Did we cover that? Okay.
Yeah, but the one, so the one that we didn't cover, which is the before last, if you see it, from Christine Baghini, she said, does it include topics such as advocating with insurance about getting the person into a specialized DOC program? I think that this will be the last question that we could. It's true, advocating is such a big thing, and they learn to be, but it's not an easy thing. So is it covering that? I mean, I don't know actually.
Yeah, so there are, and Brooke, I think you worked a little bit more directly on this topic, but yes, under the resources tab, there's all sorts of guidance. Not necessarily like this is what you could say to your insurance, but there's guidance, and one of the fact sheets that's links to is specifically about finding an appropriate program for your loved one with the DOC, which is actually a TBI model system fact sheet. So there is some content there, as well as access and direct resources, again, American focused, but to long-term care providers and, those types of senior care, life care planners who can help them navigate those sorts of issues. And yes, there is an overview of the coma recovery scale, as well as all of the the ACRM approved scales are all linked to them. Those are actually through the Shirley Ryan website. And just quickly, I also see a question about the institutional barriers with sharing other people's resources. Yeah, so that was, most of these resources are publicly available through these institutions' websites. The barriers that we did have, for example, were like Spalding, that underwent some sort of institutional change since the time they gave us their homegrown PDFs. And now we're trying to talk to them to convince them that it's okay to share, because under their new ownership or whatever it is, now they can no longer share that intellectual property. Again, that's part of why we wanted to create something that was more public, that linked to other websites and things, because a lot of facilities might not be willing to share their own PowerPoints and things like that.
Thank you for inviting us
indeed,
to speak to you.
Sorry, Aubrey, of course. Thank you for accepting again. I think that definitely having a bridge between the ACRM, DOCSIG, and the IBIA would be wonderful in the future. And maybe that would be a first project that we could work on. I know that there is a few things that we're interested in, and maybe Brooke, you could actually lead that part. We could discuss about this at our next meeting. And just try to develop, or at least have a first step, a baby step, because I know on your side you have a lot of things to do. So I certainly don't want to overload you guys, but definitely important content to share and expand to other to overseas, we'll say.
Well, and I think also
But,
just from a not just a dissemination, but from the sustainability issue that Brooke mentioned, we're about to start new search terms and an updated scan. So the timing is right if your organization is receptive to collaborating, because maybe we could make a more expansive search this time and have some people responsible for different international regions. And now that the template is in place, the sky's the limit with respect to what can be added into that.
with pleasure.
For us too. So thank you so much for the invitation to be able to speak about this.
Thank you guys, and thank you everyone for attending our webinar series. We'll have more in the future, so I will keep you posted on when our next one is. Yeah, have a great day, great night wherever you are, and see you to the next one, or maybe see you at the ABI. Definitely see you, Brooke and Amy, at the ABI.
Vegas.
Take care, everyone.
Okay.
Thank you for attending.
Bye, everyone.
Bye. Thanks.
Bye. Bye-bye.
Thank you.